Hello, and welcome to North Country Matters. My name is Donna Seymour. I'm your host for this program and a member of the St. Lawrence County League of Women Voters, one of the civic partners for this show. Today, my guest is Douglas Wildermuth, who is just been named the first ever director of Clarkson University's Emergency Medical Services Program. He's here to talk to us about the new EMS program Clarkson is instituting to address the continuing need to train EMS personnel here in the North Country. Doug, welcome to North Country Matters and to the Potsdam community. Your appointment was just announced at the end of March, and you have certainly had to hit the ground running in your new position. First of all, tell folks a little bit about yourself and your background in emergency management. You have quite a depth of experience, and that is really going to help you as you create this brand new program at Clarkson.
Well, thank you, Donna, and thank you for inviting me to your program. This is a great opportunity, not only for me, but for us in the EMS. I've been involved with emergency medical services since 1992. I was a student at Portland State University, and I was looking for something extra to do on campus. And I stumbled upon the world of emergency medicine, and basically as a dispatcher. But my college advisor, who was kind of my mentor, took me under her wing, and she decided that for every course that I take, I'm going to go ahead and take an instructional course and teach others. And to be quite honest, over 30-year span, that's what I've done, from EMT to AEMT and then paramedic. I've been doing it and actively riding on ambulance companies all over New York State in conjunction with my career as a state trooper. So when this opportunity came about, I thought it was just too good to be true, and it really is an excellent opportunity for my family and I had to jump on it and take this opportunity because I knew it was another influential part of my life where I can go ahead and reach others in the world of education and make a difference.
Well, you know, it's interesting that you talk about becoming interested in this work as a volunteer and as a college student, because certainly college students have played a big part here in Potsdam in the Volunteer Rescue Squad right from its beginning. Many, many, many young people have gotten their first start in volunteer opportunity and in EMS service as a college student. So it is nice to see you come full circle and now be able to offer that to the college community as well as the wider community.
Yeah, just last week I met some of our young men and women on the Clarkson University Collegiate EMS Squad. And I was just smiling as I'm talking to them, thinking about their potential futures and how I was in their shoes at one time. And I actually came back to the office and called that mentor I was referring to right away, let her know life has come full circle. So great time so far.
Well, you know, those are the kind of phone calls that people like your mentor like to get, because they know that their influence is continuing on decades later. And that's always a really good feeling for folks.
It is, and I'm proud to say that she's actually originally from up these parts. She now lives in Syracuse, and she's been a great influence on my life. So thank you, Marley.
So St. Lawrence County, like many rural places in this state and in other states, relies heavily on a cadre of volunteers to field personnel for local fire departments and EMS units. And for a variety of reasons, the number of volunteers able to fill those positions has dwindled in the last few years, which is bringing us to a point in rural areas of near crisis. So according to John Mitchell, who's the St. Lawrence County EMS coordinator, there were 3,500 more calls for ambulance service in 2021 than there were in 2000. And the call volume is skyrocketing, which has taken a real toll on the small departments and service providers. They can't keep up with the increased volume of calls with the number of volunteers they have available. And of course, one of the barriers is to enough EMS personnel is the training that's required to become a first responder. So this is where Clarkson has stepped up to the plate. Doug, tell us about Clarkson's plans to train the next generation of emergency service medical responders in St. Lawrence County. What will that and what does it involve?
Not a problem. I can clearly articulate Clarkson's plan, but the first thing I'd like to do is thank the men and women that are out there right now, still serving in our ambulance organizations and fire departments with ambulances, because you're right, EMS is at a precipice right now, and we're feeling it locally in this county. It's very tough. One thing that you didn't mention was the decline of volunteers. And unfortunately, with COVID and people taking second looks and analytics of their life, knowing that some loved ones are being succumbed to this pandemic, you take a little bit of investment, and that's scary. So some have actually left in addition. But that said, we need more. We need more providers. We need more good skilled people that will get into the field and help us manage this. And that's where Clarkson is stepping in. We have a great program structure set up this far. Before I even got here, the powers that be laid some excellent groundwork. And right now, the way that Clarkson University is setting up their EMS programs is by doing 2 every semester. We're going to do 1 on campus and 1 off campus to serve the rest of St. Lawrence County, because being a course sponsor, we understand that our obligations not only to our students, but the community, the St. Lawrence community that we serve. So we're going to go ahead and ensure that we're doing that. That said, Governor right now at EMS is conducting an EMT course down there in the southwestern part of our county, and they're working with us to go ahead and ensure that that happens thoroughly. We have about 15, 16 there, and we hope to be graduating all of them in the next couple of weeks. Basically within the next month, we hope to have another 15, 16 certified. Now, they are a little diverse in the fact there's some that will serve those local communities, but some are going to school up here as well. Likewise, we have about 30 right now in the Clarkson University classroom. So both of these courses are being done at night. And if we can go ahead and graduate just a little under 50 new EMTs, that's going to be a big asset to not only our community, but some of the college students that will go home and support their community to come back next semester and help out locally as well. So we like to think that we're infusing the infrastructure some. And then next, well, actually, we're not even waiting until next fall. We're actually doing a summertime class as well. It's going to be 11 weeks. It's going to be very fast. But that said, it's kind of a asynchronous class where you can do your stuff at home and then come into class and do a lot of the hands-on. I've had success with this type of training program before, and we're really excited to get this up and running despite our small time frame to get this going. So hopefully people that are interested will be able to reach our website and register for that class today, if not tomorrow. And then the fall, we're excited to go ahead and announce 2 more programs. Another one on campus, probably more towards the northern part of the county, as well as one on campus. So, if you do the math a little bit, and a little under 50 right now, let's say we do 2025 during the summer and another 50, in the fall, we're really exponentially growing our EMT population. This helps us in so many avenues. One, we need that basis. We need the people to go ahead and take people into the hospital per the DOH standards. So that's good. That's a checkbox, and we're going to help with that. But it also lays the groundwork for people that want to learn more. And this excites us because in January 2023, with cooperation with the Department of Health and the powers that be here, we hope to be announcing our first advanced EMT class come January. And what this will do is also infuse that EMS community with more advanced level training. And then down the road, 3 to 5 years, we're hoping that we can actually start and get going a paramedic program that will basically be the precipice of education, not only for the St. Lawrence County and Clarkson, but we also hope to go ahead and lead by example to show other universities how you can build this infrastructure and get it out into your communities and help EMS.
That is a very ambitious program. And, as I was thinking about talking with you today, I don't know anybody who has not had to call an ambulance, either for themselves or a family member at some point during their life. And so the folks who give their time to these local units are making a tremendous difference in their community and in the lives of their neighbors and their friends, to say the least. Doug, let's take 1 minute here to talk about what is involved in the basic EMT course in terms of what will you learn. For somebody who's exploring this, what do they need to know about an EMT, the basic EMT course?
Sure. The basic EMT course can run anywhere from about 120 hours to 180 hours, depending upon how much time they put in at home as well as in the classroom. And the ranges vary based upon the type of course that you would sign up for. All sit down in the classroom versus a hybrid, asynchronous at home, and what have you. But within the course itself, you're going to have a lot of different sections. And the first session starts off with the laws in regards to what you can do in the field, how the 911 system works, the difference between an EMT and a paramedic, the legalities behind it. It's quite informational. Right after that, you get straight into the patient assessment station, or should I say session, where you actually sit down and look at how to approach a patient of any sort, somebody that has traumatic injuries or somebody that's really seriously medically ill. So they'll go ahead and do a patient assessment that includes vital signs and symptoms of the patient. Then we'll dive a little bit deeper into the medical sessions, where you'll discover the difference between congestive heart failure and pulmonary edema, or the classic myocardial infarction or heart attack or stroke. And those are just some examples. Soon after that, we'll turn to the trauma series or sessions as well, where what do you do when you come upon somebody with a severed arm, or that's grossly bleeding from some traumatic incident, from a knife wound to a car accident, and how do you treat that patient in time of an emergency? Then when you move on to the special sections, such as obstetrics, geriatrics, pediatrics, and by the end of the last session, which is operations, you're really taking a lot of your patient assessment, the special necessity medical or trauma situations, and or taking that special geriatric or obstetrics patient, and you're putting it all together. So when you get there, you have a wholesome background and knowledge base of how to treat the basic things you may run into in the back of the ambulance. So it's a cumulative process that we like to think we successfully bring together and make a difference for every EMT student.
Thank you. Not for the faint of heart, but it's not stuff that you can't learn either. So that's great. So Clarkson has made a significant investment in their graduate health provider programs that it already has: physician's assistants, occupational therapy, and physical therapy. How do these programs and the physical operations that you have at Clarkson in order to teach these students, how will this help you get the EMT program up and running? How do they integrate?
Well, right now, my office is actually based out of the health sciences building. So the PAs are downstairs, the PT department I'm actually on the same floor with, and the occupational therapy is upstairs. But it all goes hand in hand. And I think this is some of the uniqueness of how the founding dean, Leonard Johns, put this all together. When you think of an emergency in any society, the first line of healthcare is EMS. Somebody calls an ambulance like you described, the EMT and or AEMTs or paramedics will get there, and that's where the EMS education program comes in. They'll go there, they'll pick up the patient, provide the emergency type care, and they'll bring them to the hospital. When they get to the hospital, and this is all in theory because Clarkson doesn't own a hospital, we can supply the PAs that are there in the emergency room where they're working with the patients that EMS just delivered. And if it's something like a trauma arrest that the PAs can help out with, or if it's something as simple as a broken ankle that they'll handle mostly themselves, they're an intricate part of that healthcare system. Now that we're at the definitive care of the ER in the hospital, and let's say the patient does get admitted, they'll go to the floor and or they'll need further services such as physical therapy or occupational therapy. So this continuum from pre-hospital care all the way through to the follow-up finishing care to get them back into society, that's the continuum Clarkson University is really trying to manage and create and make a better healthcare world in.
Well, those things are all true. The other thing that is also true is that anybody who wants to go into one of these fields from the North Country doesn't have to travel very far to do it. So that makes a huge difference in terms of the opportunity to get to get these continuing education under your belt and then find a good job, because goodness knows healthcare is one of the growing areas of employment, not
Yeah.
just in the North Country, but everywhere.
And the neat thing about what I like about the EMS education program is, let's say you want to be a PA and you take an EMT course and you realize, what, EMS may not be for me, but I really love the PA field. There are skill sets and patient interactions that you can use in the EMS program in the PA program. And the same applies for occupational health and PT. So really, the EMS education could be a founding basis for the others, but it doesn't have to be. If you still want to stay in that field, you can get a lot of the skill sets out of an EMT program, use them at home, donate them to volunteer emergency squads, or not use them, and know that in time of emergency, I remember how to appropriately do CPR so I can make a difference in the community.
That's right. So one of the questions that I think people will have if they are looking to take the basic EMT course, which is what the first thing that you're going to be offering, is how do people sign up? What are the costs and what's the time? You've already talked a little bit about the time commitment, but those when people are working a regular job and they have a family and they're going to have to go someplace to take night classes, that can be a barrier in some people's lives, and also just in terms of the costs. So talk
Sure.
a little bit about that.
Yep. So on our website, clarkson.edu/EMS, we can learn more information about when the courses are and register. But generally speaking, EMT courses are about $700. If you work for an EMS agency or a fire department, you can actually be reimbursed that money upon successful completion of the program. So almost, not everything, almost everything could be free if you're associated with a volunteer agency. There are book fees, which could be a couple $100s. And then I think that's it, just generally speaking, for the common layperson that would like to become an EMT. If you want college credit for it, that's going to be a little bit more expensive. But I'd be lying to you to tell you exactly what the cost is right now. I did not do that research. But that said, you do have the opportunity to get college credit. Not all courses are college credit applicable.
Mm-hmm.
So next fall, the one on campus will be, but it doesn't mean you have to go ahead and do the college credits to be involved in the class. We have participants getting college credit and not getting college credit sitting right next to each other in the classroom, and it makes no difference. But those are the costs. I mentioned about the time, but I guess one thing to add upon the time is the hands-on skills. Most adult learners are learners by doing, saying, and watching. And that's what we do. We go ahead and we took a look at the learning process and we incorporate that right into it. So you're not just sitting there all night twiddling your thumbs writing notes. You're actively getting out of your seat, putting on a splint, stopping the bleeding process, the fake bleeding process, and applying tourniquets. So you get the whole entire instrumental meaning behind and principles, practices with your hands.
So talk just a little bit, although this is down the road someplace, just talk a little bit about what is involved in the paramedic program. Obviously, if you've been an EMS and an advanced EMS provider, the paramedic program is a natural progression. So how is that going to work?
Great question. I'd like to further expand upon that by moving into the AEMT and then the paramedic, because I think it's important that everybody understands that there's levels to achieve. And you may, if anybody desires, go straight from EMT to paramedic. Depending upon your location within the state, you have that opportunity. But I did mention earlier that in January, we hope to be doing our first advanced EMT. So what's the difference between an EMT and an advanced EMT is a skill set of advanced life support skills. One of them is intravenous catheterization. So in order to go ahead and infuse fluids into a human being, you need to be good at putting an IV into somebody's vein and hanging the fluids, doing it aseptically, using best practices so there's no infection to the site, so on and so forth. That's one skill set of an AEMT. Another one is actually inserting a tube down somebody's throat that might be unconscious, known as an endotracheal tube. You use a laryngoscope blade to displace the tongue over, slip this tube through the vocal cords. I'm sure people have seen it on TV where you use a bag to put it on the end of a tube to make people breathe. That's an advanced procedure that, again, an AEMT can do. So those are just some examples of the advancement from basic to AEMT. There's a couple more here and there. But when you go to paramedic, not only can you do that skill set, but there's a lot of medications that come on board as well. When you establish that somebody has extremely high blood pressure and you need to go ahead and give the appropriate medication, not only can you draw that up, but you know the AMP behind what this medication does within the body. So like a physician, like a PA, extra schooling is needed for that. And those medications can go ahead and make a big difference. And then not lastly, but the next big paramount issue of paramedic from AEMT is going to be the cardiac monitor. When you go ahead and place a 12 lead EKG on somebody, there's certain little bumps in areas that you can look on that electrocardiogram and say that person is having a heart attack right now. There's other areas where you might see it and say, I know they're semi-conscious, but in order for this person to live, we need to zap them right now with these pads. And those determinations with great skill set and knowledge and education can be determined by a fully qualified paramedic. And those are some of the differences in tiers amongst each level.
And of course, the whole point of all of this stuff is to keep you alive long enough to get to the hospital where they can they'll have the equipment and the personnel to handle whatever is going on.
More definitive care. Yes, yeah. Absolutely. It's one of those processes where, the healthcare system is designed from 911 to EMS and fire department and law enforcement involvement, all the way to the definitive care and the ER and so on and so forth, to actually get that person back to regular living again.
So, Doug, as we come to wrap up here a little bit, I want to give you an opportunity to talk directly to your potential EMS candidates out there. What do you want them to be thinking about as they consider the needs of their community and how they can get the skills and training they need to make that real difference in people's lives? Who are you looking to bring into this program, and what do you want them to be thinking about?
Well, I think the first good skill set that if anybody's kind of on the fence of whether they should be an EMT or not is the intrinsic desire to help somebody. And I don't care if it's running down to your neighbor's house and getting them a bag of groceries. If you have that little flame inside you and you think that you're going to like the medical field, this is a great start. That desire, along with the education that we can provide, will help fuel that and expand your knowledge in the medical field. From there, the possibilities are endless. I mean, whether you want to go to AEMT or paramedic and or looking at other healthcare fields such as PA, we've seen students, or I've had students over the time that have successfully gone on to be physicians, PAs, respiratory therapists, nurses. And if that's a big jump for somebody to go ahead and get to, they should think about EMS, because you can start off from the volunteer perspective, but then you also have plenty of paid positions out there in the community as well. So it could be a side job. If you wanted to make a career, you could, especially some of the young people looking to build upon maybe the regular kind of fast food job and do something more important and give back to their community. This would be one of those golden opportunities, because we like the young blood, but it's not a requirement to be young. Any age can do something like this. And with the technology out there right now that's assisting us for lifting patients and moving patients, as well as the fire departments that have been great with their firefighters to help us move patients, extricate patients out of vehicles, you shouldn't have or feel the need that this needs to be single-handedly done by yourself. It's a team effort, and that's one of the things that we also breed within every EMT class. So,
well, one of the real truths of any kind of an accident or emergency is the faster that you can get somebody there to help them, the more likely they are to have a successful outcome. So having a widespread dedicated corps of EMS folks all across this county, because this is a huge county and transportation and distance is one of the barriers to get folks to the hospitals, is going to be a real key.
That's for sure. That's for sure. St. Lawrence is geographically the largest county in New York State. And learning some of the areas today, you know, I'm a month resident right now, so I don't know it like you, many of you do, but I am learning and hearing some of the strifes and difficulties. So we're being analytical about it. And as you mentioned, John, describing the problems that we're having in this county, Clarkson is looking to solve the educational component and help feed the system with more providers, which I think would help. Not all the problems, but I think it will definitely help in one of the most instrumental areas to ensure that we have the care that the public needs.
Well, we have a lot of fire departments and EMS personnel who are aging out now. And without the young people coming in or younger people to come in to fill those slots, there are going to be a lot of deficits in a lot of communities. So this is a great way to begin to address that problem. And at 25 and 50 new people every semester, it's going to fill the gap pretty quickly, isn't it?
We hope, you know, we do recognize that we have a lot of young minds that we're also educating, and they might not be, you know, 10-year residents of the area. We hope they would be. But that said, EMS is not necessarily a field that everybody's been surviving in for 60 years. It's typically a stepping stone to bigger and better things, and we're okay with that as long as you have the right education and you can give back.
Well, thank you for coming in today and for taking time out of your very busy schedule as you start putting all these pieces together to talk to us about it. And I hope that folks who have a chance to listen to what you've had to say will think, hey, maybe this is for me, and you'll get some inquiries and some phone calls and some fresh students, because filling these gaps is really going to improve the quality of life, not only for the residents, but for the folks who do this kind of work, because it is so fulfilling, isn't it?
It is fulfilling. I wouldn't have been doing it for, 30 years if there wasn't something inside me saying, I know that I'm doing something right. But again, I want to thank you for this opportunity to spread the word. I appreciate that. And anything that I can do, please let me know.
Well, thank you very much. Maybe when you get to the point to put the next paramedic program up, we'll have you back and we'll talk about that a little bit more depth. But thanks for coming in, Doug.
Thank you, Donna.
So these conversations are a production of North Country Matters. This show is a civic collaboration between the League of Women Voters of St. Lawrence County and the Potsdam Public Library. Until next time, remember, our North Country matters.